an infant, if you take an infant, and we're all wounded in infancy, and so many other problems we deal with go back to very early in life. So for an infant, safety is not a question of the absence of threat. Because in the average home, there's no threat in the sense of saber-toothed tigers or enemies. But the lack of a threat doesn't make an infant feel safe. For the infant to feel safe, he or she has to be held by the parent. Held not just physically, but emotionally. And it's in that safety that healthy development takes place. It's because of that lack of safety, that lack of being held emotionally, that underlies the source of all trauma and virtually all pathology as far as I'm concerned. Not all pathology, but virtually all. That also means that for that healing developmental force to be encouraged and invited and activated inside the person, they need to be held, they need to feel very safe. So when I talk about safety, I'm talking about the connection.
When I listen to you talk about safety, I think of, it sounds very close to how I would define love. What's love got to do with all this?
Well, I don't have to have loving feelings towards the person. I may or may not, but we're not talking about love on the feeling level. Thich Nhat Hanh, the Buddhist teacher, says that to love somebody you have to understand them. So in this case, love shows up as a unconditional determination to understand that person, so they can understand themselves. And so that means not only do you not judge them, but you also don't allow them to get away with judging themselves. When I say don't let them get away with it, I don't mean that you punish them or you attack them for it, but you point out when they're not being compassionate towards themselves. So it's love in the sense of holding somebody and understanding them, regardless of whether you have an emotion of love or not. That's secondary. The primary is the commitment to holding the space for them unconditionally and being determined, committed to understanding them or mirroring them in such a way that they can understand themselves. So much of it is about mirroring of what's actually, what am I seeing? And then the person can decide for themselves whether they recognize themselves in that mirror or not.
And does mirror involve reflecting back the kind of language that people are using so that people become aware of maybe how we use language?
That's an essential part of what I do, is that I reflect to people the kind of language they use. I'm trying to think if I can think of an example. To help people, it wasn't enough just to help with the physical side of things. So if somebody is depressed, it's not enough to give them an antidepressant. If somebody's got rheumatoid arthritis, it's not enough just to give them an anti-inflammatory or something to suppress the autoimmune process. You actually have to deal with their emotional lives, which means spending time and talking with people. Now, ideally I would have had people to refer to. So ideally I could have sent people to psychotherapists or to psychiatrists to deal with those issues. Because nothing in medical school trains you for that. Problem is, on the east side of Vancouver where I worked, people couldn't afford psychotherapists, for the most part. And the psychiatrists are not trained to do this kind of work at all. They're mostly trained to make diagnoses of illnesses and to treat them with medications. But they really don't much learn how to talk with people, and especially how to listen to people, with some exceptions. But I'm talking by and large. Therefore, by default, I began to spend time listening to my patients myself, and at the end of each day I would slot a couple of half an hour or hour-long sessions just for people to come in and talk. And so through that process of listening to my patients and talking with them and doing some very inept therapy in the beginning, but inept only in the technical sense, the fact that I was listening and interested in people already made a big difference for them. And then in the process of doing my own therapy, having to deal with all the issues that were besetting me in my 40s and beyond, so my own personal growth. And then for my various books on mind-body health and stress and addiction and ADHD and other issues, I had to do a lot of research. I had to absorb and become familiar with a lot of information. So all that personal work and professional work and research led me then to develop a certain way of looking at things, and from that way of looking at things arose this method of asking the right question at the right time, and that's what I ended up calling compassionate inquiry. In response to a request, after people had watched me work at workshops or in therapy with people, they would say, well, could you teach us your method? And I would say, I don't have a method to teach, I just do what I do. Until people kept saying, yeah, I know there's something here that you could teach. And I still wasn't sure whether I had anything to teach or whether it was just something that I knew intuitively how to do. Until somebody actually kind of painted me into a corner and said, okay, you got to do this. And I said, okay. And so they set up this 2-day session in Toronto, which I was initially hoping that, I was literally hoping that nobody would sign up, because then I wouldn't have to expose my ignorance. But 350 people did sign up, with another 100 on the waiting list, therapists and healthcare workers mostly. And so we did it, and it was very successful. And I realized since then that there is something to teach here, there's a method here, that people will apply it in their own way, according to their own lights, according to their own gifts. And they may have approaches or gifts that are different from mine, but there's something also very objective there that can be taught. And that's what I've come to call compassionate inquiry. You're there you're there not to make them feel better, but to make them better at feeling. And that means dealing with whatever's there. And that means, in this case, fierce compassion means that you're not afraid of the pain that might come up with the person when they're facing the truth. And I don't mean that in a confrontational sense. But the fact is, the reason that all of us have problems is because we haven't looked at and dealt with the pain that we carry. So if I'm going to be a clear mirror, and if you look into that mirror that I'm holding up for you, you're going to see your pain. You're going to feel your pain. Well, I have to be okay with you feeling pain. I can't be there to protect you from pain. I'm not there so that when you leave my office or the session with me, you feel better. If you do, that's great. And I think there's something about the truth that actually does make me feel better, people feel better. But that's a secondary outcome. The primary outcome is that people are helped to recognize the truth about themselves, which gives them much more freedom in their lives.
And to what extent do you have to be comfortable or good at facing or witnessing your own pain to be able to be in the presence of someone else facing their own pain?
Well, see, that's the whole problem with a lot of medicine and a lot of psychiatry and a lot of therapy as well, is that the practitioners haven't dealt with their own pain yet. Therefore, they get very uncomfortable with the pain of others and they want to manage the other person's pain rather than to allow the truth of that pain to guide the person's path. So it's all about symptom control and making people feel better. Now, that comes from a good intention, but it's not a helpful one. And I really do think that, so when people come to these seminars, very often they they come believing to learn a method or to learn about trauma or learn about some didactic matter, but really what I did is I learned a lot about myself. And then I'm told that because of that, I'm so much more able to be, and that the work has become much more effective, as much because of what I've learned about myself as because of the method that you taught. It helps that I used to be an English teacher, so I really like language and the meaning of, but as a method, it's not that difficult, because as soon as somebody uses a metaphor, and they'll tell you everything about the meaning. So that thing about the earth and the sun doesn't take a lot of deep thought to figure out. You just, okay, this is a metaphor. What's the metaphor about? And then right away you get the actual meaning of what they're saying to you. So that's a skill you can develop, just rather than just letting it go. Because, of course, on a conscious level, what the woman was saying is that my mother, but that's what she was saying consciously. But it's the unconscious meaning that really you have to reflect to people. And in this case, all you have to do is look at the metaphor. So if you just have an ear, when somebody's using a metaphor, look, and that's going to tell you what's really going on in their minds.
The literal meaning.
The actual meaning, yeah.
So if I can think about all you said so far, being present with people, really listening and paying attention to cues, mirroring and reflecting back what people are saying, are there, tell us about the compassion.
Well, so compassion exists on a number of different levels, but the essence of it is that you really are there to support the healing of that person, support the process of that person becoming whole, or recognizing their wholeness, which is what healing actually means. And so that means no judgment. I was talking to somebody yesterday whose therapist is forever telling her, well, if you're going to be that way, I'm not going to see you. And he will actually explode sometimes in very angry tones. Well, he's got an issue. The issue is not with the client, the issue is with himself. Because if he gets triggered, he could compassionately ask himself, okay, what is being triggered in me? Or he can be compassionately asking, why would that person say that or behave that way? But to move to judgment and move to aggression is not compassionate.